You say root canals aren't so bad anymore. Because, I mean, it's portrayed as like the worst possible thing to do.
I mean, that every joke in any movie you've ever heard is a root canal. It's awful. I mean, how many...
Like it's as bad as a root canal.
It's as bad as a root canal. It's as bad as a root canal. I don't have a single one of my patients that have felt a thing doing root canal. It's just not that way. So if a tooth needs a root canal and they're not infected, we numb the tooth up, we do the root canal, and we make the mold for the crown. Done. One visit.
So most people go to a specialist to do a root canal. You've had the training
to
do root canals?
I've been doing root canals since 1984. It was one of the things that I really learned how to do well and just always did. So I was always comfortable doing them. There are many dentists that are really comfortable doing root canal, and they should do them.
Now, I had a dentist that I spoke to, and he said, Randy, with all the things we do to save a tooth, sometimes it's better, rather than a bunch of root canals, extract the tooth and give them an implant, get a new tooth.
Yeah.
Do you kind of have that same feeling too?
Yeah,
in the right condition?
Under the right circumstances, I always tell a patient to do what I would do on me. So I know that a root canal 15 years later has a 70% chance that it'll still be there. So I kind of let the patient know that doing a root canal is a more conservative and easier procedure than just taking the tooth out and putting in an implant. But there's a 30% chance that tooth is going to fail 15 years later. So there's two schools of thought. I'm still one not to try to take anybody's tooth out if I don't have to.
Okay.
Even though I know I could put that tooth back with an implant really well. So I'm of that. Maybe I'm older and I've graduated in that train of thought that we need to save everything. But there's a really good thought process that why do root canals at all?